Well, a couple of months ago, there was a cover article in Time magazine, the big cover picture of arthritis in the hands and knees. He said, there's a coming epidemic of arthritis. Now, what does that mean? For the most part, arthritis is a degenerative disease, not genetic. It has nothing to do with age. Babies can be born with arthritis. And then there's a form of arthritis called rheumatoid arthritis, which doctors will tell you are autoimmune, but it's not. It's actually bone-to-bone arthritis with a secondary infection with a bug called mycoplasma, which is easily killable in 2 weeks with an antibiotic called minocycline, a member of the tetracycline family. What, your doctor didn't tell you about that? Well, again, arthritis, osteoporosis, osteopenia, things like osteoarthritis, degenerative arthritis, bone-to-bone arthritis, bone spurs, kidney stones, periodontal disease, which is osteoporosis of the face, are all due to multiple mineral and multiple vitamin deficiencies. Okay, and the reason why there's a coming epidemic of arthritis is because these nutrients are no longer found in your food, or maybe there's a little bit, but not certainly optimal amounts. Well, how do you detect this? Well, first of all, you can look at a hair analysis. It's kind of interesting that when you're significantly deficient in calcium, the calcium in your hair analysis is going to be high. And the magnesium will usually be high. Well, what's going on there? Well, your parathyroid glands are pulling calcium and magnesium out of the bones, trying to maintain your blood calcium. You don't get all kinds of problems, including muscle cramps and so forth, and arthritis. And so the first thing the doctor, when he sees that elevated blood calcium in your blood and elevated calcium in your hair, so we got to take your parathyroid glands out. And then if you let him do that, you're going to be married to that doctor forever because you're going to need his help on a daily basis because you really messed up your mineral system if you remove your parathyroid glands. Don't do it, don't do it, don't do it. Okay, get a hold of the books, Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book, Dead Doctors Don't Lie, the book, Dead Doctors Don't Lie, the CD and the DVD, Dead Doctors Don't Lie. All right, and the book, Rare Earth Miniatures, goes into great detail here on why elevated blood calcium and elevated hair calcium mean you have a raging osteoporosis, just the opposite of what you would think. Then, let's see here. When it comes to bone spurs, they always occur, again, when people have raging osteoporosis. The first thing your doctor will say, well, you got these calcium deposits in your bones, you got bone spurs, don't eat any dairy products and don't take any supplements of calcium. Well, the doctor has no idea. He was out probably smoking pot during those courses where they talked about nutrition, knows nothing about these things. Same with kidney stones. You get kidney stones, urologists say, oh, don't eat dairy products and stay away from calcium supplements. Well, kidney stones do not come, the calcium in the kidney stones don't come from your food. It comes from your bones when your parathyroid glands are overworking and pulling too much calcium out of your bones, and your blood calcium goes up like triple of high normal, and that really freaks doctor out. Well, I'll tell you what to do about all this in just a moment. And then, let's see here. You also want to look at kidney, well, I said kidney stones, but there's fractures. Spontaneous fractures. And you say, I'm only 30 years old, and I was, kind of jogging, and my hip broke and I fell down. Most people will say, oh, I fell down, broke my hip. No, the hip broke, and then you fell down. So what I want you to do is, again, get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book, the CD, and the DVD, Dead Doctors Don't Lie. Get a hold of the book, Rare Earth Miniatures, so you really understand what's going on here. And once you take the 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids, and then I want you to get an extra supply of vitamin D. At Young Jimmy, we have a spray, oral spray, or a capsule. On the road, I like the capsules. When I'm at home, I take the spray. With each spritz in the spray, each capsule, you get about 5,000 international units of vitamin D3. Very, very important. That's in addition to your 90 essential nutrients, which contain the D2, okay? And so you want to get the combination of D3 and D2 and all the other 89 essential nutrients. And then your bones, your connective tissue, all want to repair itself. You have the genes, the DNA, the RNA, the telomeres. They really want to heal your body, but they require raw materials to do this. And so it's imperative. It's imperative that you get a hold of these books, you get a hold of these products. And, of course, we like to use, if that's all you have, and you just have bone and connective tissue problems, I would get one healthy bone and joint pack per 100 pounds of body weight. Get an extra bottle of either the spray vitamin D3 or the capsule vitamin D3 from Young Jimmy. And they're going to support and promote healthy maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And it's amazing. It's amazing. Our bodies are meant to heal themselves. We have great genes. Humanity hasn't gotten this far because our bodies are stupid. Okay, our bodies have the ability to heal themselves, but it does require raw materials. Medical doctors have the insane belief that your genes and DNA and RNA and telomeres are autonomous, and they'll make stuff even though you don't have raw materials. They're going to do what they're going to do. Well, it's nonsense. Okay, it's kind of like having a blueprint without bricks and mortar, without wood, without screws and nuts and bolts, without carpenters and roofers and shingles and all that kind of stuff. You can have the very best blueprint of a house, but unless you have all the raw materials, the tools, and the skilled tradesmen to do all this stuff, you're not going to get a house. Same with your body. You can have the best genes in the world. You know, your grandmom could have been an alcoholic, did drugs, smoked, did bad things, and she lived to be 120. Well, unless you're taking in all 90 cents of nutrients, don't try that yourself. Otherwise, you're not going to make it to 120, guaranteed. Well, we'll be back with more Truth, Justice, and the Young Give It Away on Dead Doctors Don't Lie after these minutes. Okay, Doug, what pearls of wisdom do you have for us?
Well, in light of the tragedy that occurred in Orlando, the government has released a report now that they say 1 in 5 trauma victims may die unnecessarily, say from car crashes, gunshots, or other injuries that might be prevented with better, quicker trauma care. Doesn't depend so much on where you live, according to the government. The government found swaths in the country that don't have fast access to top care and urges a national trauma system that puts the military's battlefield expertise at work at home. They go on to say the ultimate goal would be 0 preventable deaths after injury and minimizing disability among survivors. And this comes from the National Academies of Sciences, Engineering, and Medicine. According to a Dr. Donald Berwick of the Institute of Healthcare Improvement, says today there's no way to be sure the current best trauma care is going to reach you no matter where you live. They say the report found a patchwork of care from disjointed systems of first responders to death rates that vary twofold between the nation's best and worst trauma centers. About half of the deaths occur at the scene of the injury or en route to the hospital. The military has proven that both bystanders and well-trained emergency medical services can make a big difference. A panelist, Dr. John Holcomb, a former Army colonel, now at the University of Texas Health Science Center in Houston, says the answer has always been to drive faster or fly faster. We're almost at the limit of that. Minutes really do count in these critically ill patients, but we can do things to stop bleeding, resuscitate better while we're flying or driving faster. And they go on to say, trauma is leading cause of death for Americans 45 and younger, killing nearly 148,000 people in 2014 alone, costing a staggering $670 billion in medical expenses and lost productivity. Report estimated that about 20% of the deaths could be prevented based on improvements in trauma care the military made after the start of Iraq wars in Afghanistan. They say one way to do that would be to allow military surgeons to do more work in civilian trauma centers. So there you go. Leave it to the military to come to the rescue.
Well, yeah, of course, one of the things, of course, the third leading cause of death in America is mistakes, medical mistakes. And when you look at Lucian LePay, who's the head of the public health department at the medical school, at Harvard Medical School, he came out in 1990 and also in 2014 and said that, and this is with random blood tests of people, surgeons in emergency rooms and hospitals and surgical group clinics. He found that 52%, both in 1990 and in 2014, 52% were intoxicated on alcohol, street drugs, and prescription drugs, and that's why they made so many mistakes, 52%. And I suggest to prevent those mistakes is we need to be doing breathalyzer tests on each doctor before they are allowed into the surgery rooms. It only takes a couple of minutes. We also need to do a urine test, let them come in and pee in a cup in front of a nurse so we know it's his urine sample and not his dog's urine sample kind of thing. And have a test strip that will cover most of the common drugs that doctors will take and screen them before we let them into the surgery rooms, whether it's the emergency surgery rooms or the regular scheduled surgery rooms, because 52% being intoxicated on alcohol, street drugs, and prescription is way, way, way over the top. And that's because there's no oversight by anybody. And medical doctors have been a protected monopoly for over 125 years, a protected monopoly. They are self-policing. There's no oversight by anybody. And they actually kill, injure, and infect 15 million people a year. And nobody loses their license. Nobody gets fined. Nobody gets an ocean ticket for the sakes. So thank you for bringing that up, because the whole thing is a mess because they're in monopoly, self-policing, and no oversight. We got to do the oversight. We got to get breathalyzer tests, screening tests for drugs, and then things will be good. And we'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Dublin, Ireland, and William, you're on with Dr. Wallach.
Hello, William. You're on the air.
Hello, Dr. Wallach.
Yes, sir. What's up?
Yeah, I'm calling for a young lady. She's 20 years old. She's about 4'8" and about 85 pounds. When she was 7, she developed a schwannoma tumor in the brain. I'm sure you're aware of that.
Right.
So they did.
Hold on. You said what kind of tumor? I missed that.
Schwannoma. Do you want me to spell that?
Okay, this is in her brain?
Yes.
Okay, is this a benign tumor or a cancerous tumor?
It's benign. They operated on it when she was 7. Then they did radiotherapy, and they got it down to about the size of a penny. They say it's still there now, but it's benign. But they also damaged her spinal cord.
Is this in her pituitary?
Sorry, excuse me?
Is this in her pituitary gland?
Yeah. That's where it was,
okay. Yeah. Okay, and all right. And so, what does she have any clinical symptoms? I mean, has she lost speech? Is she paralyzed? Does she have burning in her feet? I mean, what kind of symptoms does she have that might be related to this tumor?
Well, they damaged her spinal cord from the radiotherapy, so she's on growth hormones, they say, for life, because they say she doesn't produce any. They also damaged her thyroid gland, so she has low thyroid and low energy all the time. And then when she was 11 years old, she developed epilepsy, so she's a few things going on. So
she got acquired seizures, okay, and she has thyroid problems, and she's short, okay?
Yes.
And that's a growth hormone. And let's see here, and she's how old?
Yeah, she's 20 years old.
20 years old, okay. Has she gone through puberty or not? Or
yeah, she's gone through puberty, yeah. It was only in the last couple of years they put her on the growth hormone injections.
Okay, and so has she had a pregnancy? Has she been married and have a pregnancy?
No.
Okay, but she is cycling.
Sorry, excuse me?
All right, is she cycling, having her periods?
Yeah.
Okay, good. All right, 85 pounds, 20 years old. Okay, Char, what did you do for this girl? She's had a series of growth hormones. She had a benign tumor in her pituitary. She got low thyroid. She got acquired seizures. And let's say she's short. And so let's start there. What would you do for her?
Well, I give her the Healthy Brain and Heart Pack, and then I give her the Synaptive, and I give her the HGA. And,
okay, very good. Yeah, you're exactly right. And William, since she's... Well, hang on. We got to run to one of those message moments here. We'll be back with you. Hang on a moment, and we'll come back and we'll give you a program and protocol for this lady. Well, I thought I heard the noise. Maybe not. Okay. Well, there it is. We'll be back right after these messages. Okay, Doug, let's go right back to Ireland and William. And basically, Char said it right. At 85 pounds, I would give this young woman, 20 years old, with all these pituitary problems, benign tumor, which means the pituitary is missing something. And so it kind of got bigger trying to do its job because it wasn't getting what it wanted. And so they call it a tumor because it's an enlargement. But when you come down to, you look up in any medical dictionary, the word tumor, it says an enlargement. It could be an abscess. A dental abscess, the root canal abscess could be a tumor, and so forth, because any enlargement, whether it causes symptoms or not, they would call a tumor, not a cancer. And so, Char is exactly correct. At 85 pounds, they give her one Healthy Brain and Heart Pack per month, a full dose of everything per month, and that's a half a dose of breakfast and dinner. because she has pituitary problems and some of it's been removed, I'd give her the HGH. I'd go ahead and give her 3 of those capsules at breakfast and 3 at dinner time. That'd be 1 bottle a month. The HGH is an acronym for human growth hormone. It's not a hormone. It's actually the raw materials for the pituitary to do its job. Because she has a history of thyroid issues, I'd go ahead and also get her the Ocean's Gold. I'd give her 3 of the Ocean's Gold twice a day. It's 2 bottles a month. And for the acquired seizures, what would you do for her seizures, Shar?
Well, the Synaptive should help a little bit, shouldn't it?
Yep. Oh, absolutely. Let's go with Synaptive. I'd have her take 3 of those twice a day, the Synaptive, and that'd be 2 bottles a month. But also, in the Healthy Brain and Heart Pack, there's going to be the ability to give her 3 of the EFA pluses for breakfast and the 3 EFAs at dinner time. So between the ingredients in the EFAs and EFA pluses and the Synaptive and your Healthy Brain and Heart Pack and so forth, and the HGH, she's going to see some significant improvement. Now, I haven't seen all the records. I don't have the CAT scans of her head and so forth, so I can't give you percentages, but it will be some interesting improvements. And so if you would, William, please call us every 2 weeks or so, or anytime she goes to a doctor for an update evaluation, give us some additional information. But just let us know what's going on. Staying the same, getting better, getting worse, and then we know how to help her. Thank you so much. Okay, Doug, let's go to callers.
All right, let's head to Miami, Florida. And Anthony, you're on with Dr. Wallach.
Anthony, you're on the air.
Yes, I'm Dr. Wallach. My name is Anthony. I'm under Ernestine Ray. I'm a provider of your services.
Okay,
and my son, he was diagnosed about 3 years ago with schizophrenia. And
how old is he?
He's 20 now. And they put him on olanzapine, but instead of getting better, he's getting worse. And
okay. Now, have you told the doctor he's getting worse?
Pardon?
Have you told the doctor who prescribed that medication that he's getting worse?
I haven't yet.
Okay,
no,
well, I would immediately, of course, and let him make some adjustments. You got to let the guy who wrote the prescription when it comes to brain drugs, because we don't want any nasty things going on. And how much does he weigh?
He weighs about 243. He had an embolism.
How tall is he?
He's about 5'7".
Okay, now hang on. We'll be back after these messages. Okay, Doug, let's go right back to Florida and Anthony. Okay, as we went to the break, Anthony, I thought I heard you say that your son also had a thrombosis or a blood clot somewhere. Was that correct?
Yes, in the lung, yes.
Okay, so a pulmonary embolism. Okay.
Yeah.
And anything else?
No, he's just overweight as a result. He's taken the olanzapine, and that, made him increase weight almost 100 pounds.
Yeah, I know. He needs to lose about 80 to 100 pounds, yep. So, did he have asthma as a kid or bronchitis, anything like that?
Yes, he did have asthma and bronchitis kind of thing.
Okay, any skin problems, any eczema, dermatitis, psoriasis, or rosacea?
No, none of that.
Okay, Charmaine, what is Anthony's son's major problem here?
He's got a gluten intolerance, and that's why he's getting multiple problems, because he can't absorb nutrients.
It's because all of these problems are nutritional deficiencies. The weight gain is a nutritional deficiency, not lack of exercise. The pulmonary embolism, a blood clot in the lung, is due to a nutritional deficiency. Okay? And, of course, the schizophrenia is due to nutritional deficiencies of the brain. Being overweight is a nutritional deficiency again. And so what would you give this kid who needs to lose about 80 to 100 pounds? What would you give him?
Well, I'd give him 2 Healthy Brain and Heart Packs. I would give him the Synaptive. And for the weight, I would give him the ASAP.
Okay.
Get him on a gluten-free diet, of course, and none of the bad stuff. No oil, no burnt animal fat, no margarine, no salad oil. Eat butter.
Okay, well, sure, exactly right here, Anthony. Everything needs to change for your son. And do you have any other children by the same mother, from the same lady?
Yes, I have a daughter.
Does she have any problems?
Skin problems, facial.
Yeah. Facial, eczema, adult acne, rosacea, that kind of stuff?
Yes. Mm-hmm.
Yeah. Okay, well, you need to have a family meeting because you and your wife and your son and your daughter and any of your wife's brothers and sisters and your wife's mother and her brothers and sisters, her aunties and uncles on her mama's side, they all have the same problem. As Shar said, a gluten intolerance, and so everybody needs to hear that CD called Serial Killers and to learn how this all works. You'll add 25 to 50 healthy years of their life by educating them on this, getting them all on a special diet, no fried foods, no processed meats with nitrates and nitrites, no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, all that's got to go. No oils, as Shar said. Absolutely no microwave popcorn, no theater popcorn, no olive oil, coconut oil, margarines, mayonnaise, sawdust, and cooking oils. No gluten, no wheat, barley, rye, and oats. Imperative there. No wheat, barley, rye, and oats of any kind. And then, as Shar said, I would go ahead and give your son 2 of the Healthy Brain and Heart packs per month, a full dose of everything twice a day. I'd also get him the Synaptive, which is particularly for the brain cells talking to each other properly. Have him take 3 of those twice a day. That's 2 bottles a month of the Synaptive. And what would you give him, Shar, for the embolism, the blood clots in the lungs?
Oh, he needs to take the Niacin Plus, or he could take the Nightly Essence, either one.
Yeah, I'd like to see him take the Niacin Plus, as you pointed out. That'd be my first choice, too, because it's good for the schizophrenia. Okay, because for niacin deficiencies, there's also brain problems and nerve problems. So I'd go with the Niacin Plus, add 2 bottles of the Niacin Plus per month. That's 2 of the Niacin Plus capsules, tablets at breakfast and dinner. They're time release, they're non-flush. You won't have to worry about that. But they also contain an enzyme called nattokinase, which dissolves blood clots. So if there's any future ones, he's going to less likely have it even show up. Also, for these pulmonary embolisms, sometimes there's some little residual ones there, and of course the nattokinase and the ultimate Niacin Plus actually, what it does is it dissolves blood clots. That doesn't get any better than that. And also for the schizophrenia, I'd throw in the D-stress capsules, capital D like David-stress, and have them take 3 of those twice a day. That's 2 bottles a month for the metabolism of the brain. What special food would you have them eat, Shar, for brain health?
For brain health? Well, fish and good fat, eggs.
What about things that come out of chicken?
Come off of what?
What would you want to eat coming out of a chicken if you have brain problems?
Oh, I said eggs. I said eggs and butter.
Oh, eggs and butter. Okay, you're exactly right. And eggs is his body weight. I have him eat 6 to 10 eggs a day. They can be poached with a soft yolk, soft boiled with a soft yolk, soft scrambled in butter, not fried, not cooked in oils, but cooked, soft scrambled in butter or poached or soft boiled. And then you said ASAP for his weight loss. He needs to lose 80 to 100 pounds. And so I'd go ahead and give him, I'd go with 2. If it's not a financial thing, I'd go with 2 of the dropper bottles of the ASAP, an acronym for as slim as possible. As soon as possible, let him take a dropper full, not a drop, but a dropper full under his tongue 30 minutes before each meal, a second dropper full under his tongue 15 minutes before each meal. So he's going to have 2 droppers full before each meal, one 30 minutes before the meal, one 15 minutes before the meal, and let it absorb through his oral tissues. If he swallows, it won't hurt him, but he won't get maximum benefit. And he should see within a couple of days to a week of weight loss beginning at a half a pound to 2 pounds a day. And he'll be healthy because he's getting all the nutrients. So give us a call. We want to know every couple of weeks what his weight is, how he's doing. And on the medication piece, I would go ahead and make sure the doctor knows that he's not doing well on the medication, that he's showing an increased, a downward trend, even though he's getting this medication. And so the doctor may want to reduce it or change it or whatever. That's the guy who wrote the prescription has got to do that, okay? Let's hear from you every couple of weeks. Anytime your son goes in to be evaluated by the doctor, we'll walk through this with you. All right. Doug, let's go to callers.
All right, let's head to California. And Robin, you're on with Dr. Wallach.
Hello, Robin, you're on the air.
Hi, Dr. Wallach. Thank you for taking my call.
Yes, ma'am. How can we help you?
I'm calling for a gal, Angie, who has recently gotten off Cymbalta. She's new to longevity. She's going to be starting on the 90 essential nutrients. And she's getting bloating. She's been off Cymbalta for antidepressants since May 24, and she's getting bloating around her belly. She weighs 147 pounds, 5'7", and has several other issues besides the recent weight gain around her abdomen. She has a lipoma that was removed around her waist, and then she has another one that's not a candidate for surgery. She's got allergies and itchy skin and heartburn and occasional plantar warts and fatigue. And, of course, she's on other antidepressants. So she may be on a sort of a tight budget, so recommend what's optimal, and then if you can recommend what's absolutely essential, that'd be awesome.
Okay. Shar, what's your basic problem? Because you got itchy skin and all this
definitely other... she has a gluten intolerance, no question about it.
Yep, you're exactly. You get an A+ there, kiddo. Very good. And she's got digestive problems. She's, with the bloating and everything, itchy skin. That's all gluten intolerance, as Shar says. And let's see here. She's got depression, fatigue, and that kind of goes along with secondary to the gluten intolerance. How many nutrients does your brain need, Shar?
All 90.
Well, there you go. And you can't absorb them efficiently when you have gluten intolerance, so we've got to work on that. And we'll be back, Robin, after these messages to give you a program. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go right back to California and Robin. Basically, what I would do here is make sure that this individual, like Shar says, get a gluten-free diet, no processed meats, no fried foods, no oils, no gluten, wheat, brother, and oats, no carbonated drinks, even ones you think of as being benign, like club soda, sparkling water, ginger ale, that kind of stuff. And then because there's bloating, I'd throw in the ultimate enzymes, maybe one or two, like a minute or two before each meal, a couple ounces of water. We got a line of calls here, so I'm going to try and go quick. Really should take the Healthy Brain and Heart Pack. I'd go with the Healthy Brain and Heart Pack, and one of those because 147 pounds, and then an extra bottle of selenium, so you can take 3 of those twice a day. Divide the Healthy Brain and Heart Pack in 2, so everything else is a half twice a day. And for the depression, I'd go ahead and give her the Synaptive, 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 3 of those twice a day. That's 2 bottles a month, and also the D-Stress capsules, capital D, like David-Stress. Have her take 3 of those twice a day, 2 bottles a month. And plenty of eggs. As Shar said, I want her to have 6 to 8 eggs a day, soft scrambled in butter, soft boiled, soft poached. Okay, Doug, we can try and squeeze in another one.
All right, let's head to Patricia in Illinois.
Hello, Patricia, you're on the air.
Hello?
Hello, Patricia, you're on the air. We only have a moment here, kiddo, so we need to go fast.
Okay, thank you for taking my question.
Yes, ma'am.
I developed a cold, and I usually take all natural products, never been under the doctor's care, never been under medication. When the cold went away, I developed like some chest wheezing. Okay, then that turned into shortness of breath. I have a constant tingling in my throat and a cough. And so I got on your Healthy Start Pack.
Okay.
And yesterday I just started taking your Majestic Minerals and the selenium. The shortness of breath has improved somewhat.
Okay, well, let me ask you a question. We only have a moment left, but let me ask you a question. When you got the basic program, are you taking the EFA pluses, the little amber-colored soft gel capsules with the omega-3s in it?
Yes, the EFAs,
EFA plus. Yep.
Yes.
Okay, how much do you weigh?
I weigh about 155 pounds, and I'm 5'5".
Okay. Well, what I would do, I would double up on those EFAs instead of taking, let's see, again, I would go with 2 of the Healthy Brain and Heart packs. That would allow you to have 3 of the EFA pluses at breakfast and dinner and 3 of the EFAs at breakfast and dinner. So you're going to have 6 sources of omega-3s twice a day, 3 of the EFA pluses at breakfast and dinner and 3 of the EFAs at breakfast and dinner. That's the raw material for your lungs to actually make a hormone that's in the prostaglandin category. It's called prostaglandin, not because it has anything to do with prostate, but the original place they found that category of hormones was in the prostate gland, but there's many of those around the body, including the lungs, which require which provide for the bronchi opening up, and so you don't wheeze when you get a cold and that kind of stuff, or you have asthma. So it's imperative not only to get rid of the gluten out of your life, no fried food, no processed meats, no oils of gluten, but additionally, I would go with 2 Healthy Brain and Heart packs, so you can take 3 of the EFA pluses twice a day, 3 of the EFAs twice a day, give your body the raw materials so your lungs can make the prostaglandins, which support healthy respiration through dilated bronchi. And if you're going to use something as a spread on your gluten-free bread, I would use butter, obviously, instead of margarines. No salad dressings, no cooking oils. If you eat canned fish, whether they're sardines or tuna, no oils. They have to be packed in water. And so make sure the dosage is correct there and make sure you're kind of going the right direction. And we do also have our good herbs, healthy lung support, good herbs. Okay, I would also use our Breath of Life from our aromatherapy oil. You can put a couple of drops of that on your chest or on the bottom of your feet. And then call us every couple of weeks. Let us know how you're doing. Well, thank you, everybody. Great testimonies and questions. Hey, thank you much, Shar. Super job as usual. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order. PureWorks.
Good liver health is vital to your overall health. Did you know the liver is the largest gland in the body? Generating digestive enzymes, converting fat into fuel, controlling metabolism, regulating cholesterol in the blood, and neutralizing toxins and waste products. Decreased liver function can lead to debilitating diseases. Hepal, a proprietary blend exclusive to Prohoba International, can help support healthy liver function. Hepal is a blend of natural organic pollen extracts, including essential enzymes, botanical glutathione, which is considered to be one of the most powerful antioxidants for detoxifying free radicals and exogenous compounds, superoxide dismutase, and aloe vera, formulated to cleanse and support healthy liver function. If you'd like to have healthy liver function, call your local longevity distributor today, and don't forget to ask about home-based business opportunities.
If you've been diagnosed with type 2 diabetes, prediabetes, or the metabolic syndrome, and you're tired of seeing your blood glucose levels rise and fall like a ship on the ocean, but you don't want to take those drugs the rest of your life, Longevity has an alternative. A product called Sweeties has been developed just for you. Used as part of your regular diet, Sweeties helps maintain healthy blood sugar levels, a formulation specially designed to nutritionally assist your body with the regulation of your blood sugar level. Sweeties supports healthy glucose metabolism because it's fortified with aspartic acid, chromium, and vanadium. all to help you promote healthy blood sugar levels. If you want to get off those drugs and control your blood sugar metabolism naturally, try Youngevity's Sweeties product. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Longevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Longevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables. And besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the whey shakes again, the chocolate whey shake. And you need to remember, the whey shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities.